As a brain doctor, I need you to hear this carefully. A mini stroke, often dismissed because the symptoms fade quickly, is not harmless. It is one of the most urgent warnings your body can give. When blood flow to the brain is briefly interrupted, even for only a few minutes, brain cells are starved of oxygen. The symptoms may disappear, but the danger does not. A mini stroke is the body's way of telling you that a major stroke could be approaching, one that can take away your ability to speak, move, or even survive. Many older adults mistake a sudden headache, brief dizziness, slurred speech, or temporary weakness in an arm or leg as something minor, something to shake off. But those fleeting moments are often the red flags that a larger, more devastating event is coming soon. Every mini stroke should be treated as a medical emergency, because the clock is already ticking. Studies show that people who suffer a mini stroke are at very high risk of having a major stroke within days or weeks if nothing is done. The hopeful truth is that recognizing these signs early, seeking immediate medical care, and addressing the underlying causes can prevent tragedy. In this video, I will explain what a mini stroke really is, how to recognize its warning signs, what causes it, and the steps you must take to protect yourself or your loved ones. Before we begin, I want to hear from you. Have you or someone close to you ever experienced sudden dizziness, blurred vision, or difficulty speaking that passed after a short while? Share your story in the comments, because your experience could help someone else recognize the danger and take action before it is too late. 1. What is a mini stroke? A mini stroke, also called a transient ischemic attack, is often misunderstood. Many people hear the word mini and think it is something small, something that can be ignored. But that belief is dangerously wrong. A mini stroke happens when blood flow to the brain is blocked for only a short time, usually a few minutes, sometimes up to a couple of hours. Unlike a full stroke, the blockage clears before permanent damage is done, so the symptoms fade. This temporary nature is exactly what makes it deceptive. The body seems to return to normal, and the person may feel relieved. But the truth is that the brain has just sent a clear signal that its circulation is unstable. A mini stroke is not the end of the problem. It is often the beginning. During a mini stroke, the brain is deprived of oxygen and nutrients just as it is in a full stroke. Cells begin to suffer immediately. The difference is that blood flow is restored quickly enough that cells do not die permanently. However, the event reveals that arteries are narrowed, weakened, or at risk of clotting. Think of it like a small crack in a dam. Water may leak for a short time and then stop, but the weakness remains, and eventually the dam could burst. In the same way, a mini stroke shows that the brain's blood supply is vulnerable, and without urgent action, a major stroke could strike without warning. Symptoms of a mini stroke often mimic those of a full stroke. Sudden weakness or numbness in the face, arm, or leg. Difficulty speaking or understanding. Blurred vision, dizziness, or severe headache can all appear. The key difference is that they fade quickly, sometimes within minutes. Too many people dismiss these episodes as fatigue, stress, or simply getting older. This is a tragic mistake, because studies show that within days to weeks after a mini stroke, the risk of a major stroke skyrockets. Up to 1 in 3 people who experience a mini stroke will later suffer a full stroke if they do not receive treatment. The danger lies in the false sense of security. Because recovery seems complete, people delay seeking help. they might rest, drink water, or wait for the symptoms to pass. And when they do, they return to life as usual. But the brain does not forget. The same blockages, clots, or vessel weaknesses remain. Without medical evaluation, nothing changes. And the chance of another, more severe attack only grows. Doctors view a mini stroke as a medical emergency because it is a chance to intervene before disaster. Doctors view a mini stroke as a approach through tests such as brain scans, blood work, and artery imaging. We can identify the cause, prescribe medication, or even recommend procedures to restore blood flow and prevent a larger stroke. Understanding what a mini stroke really is can save lives. It is not a harmless event. It is a loud alarm bell. If you or a loved one experiences sudden neurological symptoms that disappear within minutes or hours, do not ignore them. Treat them with the same urgency as a full stroke. Call for emergency care. Seek immediate evaluation. And demand answers. The mini stroke is not the crisis itself, but it is the warning that the crisis is coming. Recognizing it and acting fast is the difference between prevention and tragedy. 2. Common symptoms of a mini stroke. One of the greatest dangers of a mini stroke is that its symptoms are often overlooked or dismissed, because they can appear suddenly and then fade within minutes or hours. Many people assume nothing serious has happened, yet these brief episodes are the brain's way of sounding an alarm. Recognizing the signs can save your life or the life of someone you love. A sudden severe headache is one of the most common symptoms. It often comes without warning, striking with intensity that feels different from an ordinary headache. Some describe it as a crushing or stabbing pain, sometimes accompanied by nausea or vomiting. This type of headache, especially if it appears out of nowhere, should never be ignored. Dizziness and loss of balance are also frequent warning signs. A person may feel lightheaded, as if the room is spinning, or may stumble and fall without any clear reason. They may find it difficult to coordinate movements, even in simple tasks like walking across a room. Sometimes ringing in the ears or a sensation of fullness in the head accompanies these episodes. Such symptoms reflect disruptions in the parts of the brain that control balance and coordination. Speech problems are another hallmark of a mini stroke. Words may become slurred, sentences may not make sense, or the person may suddenly be unable to find the right words. In some cases, they cannot understand what others are saying. This can be frightening for both the individual and their loved ones. A simple way to test is to ask the person to repeat a short sentence if they cannot do so clearly, even briefly. It may be a mini stroke in progress. Numbness or weakness in the face, arm, or leg, often on just one side of the body, is another classic sign. The smile may suddenly appear crooked. One arm may drift downward when both are raised, or one leg may feel heavy and difficult to move. These changes are caused by reduced blood flow to areas of the brain that control muscle strength. Even if the weakness resolves quickly, it is a clear warning of potential stroke risk. Vision disturbances can also occur. Some people report sudden blurriness, double vision, or even temporary loss of sight in one or both eyes. This may last only a few minutes, but it signals that the blood supply to the visual centers of the brain has been disrupted. What makes these symptoms particularly dangerous is their temporary nature, because they disappear. People convince themselves nothing serious happened. They may attribute it to fatigue, stress, or simply aging. But these fleeting moments are often the only chance to prevent a devastating stroke. Studies show that up to a third of people who experience a mini stroke will go on to have a full stroke within a short period if they do not receive treatment. The lesson is clear. If you or someone you love experiences sudden headache, dizziness, slurred speech, weakness, or vision problems that resolve quickly, treat it as an emergency. Do not wait for the symptoms to return. Call emergency services, seek medical evaluation, and demand answers. A mini stroke is the body's urgent warning, and your response can be the difference between life as you know it and permanent disability. 3. Causes of a mini stroke in older adults. To understand why mini strokes occur in older adults, you must look closely at the changes that happen in the blood vessels and the conditions that quietly damage them over time. A mini stroke, or transient ischemic attack, happens because blood flow to the brain is temporarily blocked. The blockage may clear quickly, but the underlying causes remain. And without intervention, they can lead to a major stroke. High blood pressure is the most significant factor. When blood pressure remains elevated for years, it puts constant strain on the arteries. Over time, the vessel walls become stiff, fragile, and prone to developing tiny cracks. These weak points encourage clots to form and increase the risk that a vessel may rupture. During a mini stroke, this strain often reveals itself through a brief but dangerous interruption in circulation, atherosclerosis, or hardening of the arteries, is another major cause. This condition develops when cholesterol and fatty deposits build up along the inner walls of arteries. As these plaques grow, the vessels narrow and blood has less space to flow. If a piece of plaque breaks off, it can form a clot that lodges in a smaller artery leading to the brain. The blockage may be temporary, but it is a clear warning sign that the vessels are unstable. Heart disease also plays a powerful role. Irregular heart rhythms, such as atrial fibrillation, cause blood to pool inside the heart, allowing clots to form. If one of these clots breaks loose, it can travel through the bloodstream and reach the brain, causing a mini stroke. Other cardiac problems, such as weakened heart muscle or valve disease, can create similar risks by disrupting normal blood flow. Diabetes contributes to mini strokes by damaging small blood vessels throughout the body, including those that nourish the brain. High blood sugar levels weaken vessel walls, promote inflammation, and accelerate atherosclerosis. Older adults with diabetes face a significantly higher risk of both mini strokes and full strokes. Lifestyle factors cannot be ignored. Smoking doubles the risk of stroke by poisoning the lining of blood vessels and encouraging clot formation. Excessive alcohol use raises blood pressure and interferes with normal heart rhythms, creating opportunities for clots to form. Poor diet, obesity, and lack of exercise contribute to high cholesterol, high blood pressure, and diabetes, all of which increase the likelihood of a mini stroke. The aging process itself also makes vessels less elastic and less able to cope with stress. While age cannot be controlled, the conditions that develop with age can be managed. The presence of one or more of these causes should not be dismissed as normal aging. They are red flags pointing toward danger if left untreated. It is important to remember that a mini stroke does not happen without reason. It is a symptom of underlying disease, not a random event. By identifying and treating the causes, controlling blood pressure, lowering cholesterol, managing diabetes, treating heart disease, quitting smoking, and living a healthier lifestyle, you can greatly reduce the chance of progression to a major stroke. A mini stroke is your body's way of warning you that something is already wrong. Do not ignore it. Take action to correct the causes before the damage becomes permanent. 4. What to do if a mini stroke happens. When a mini stroke strikes, every moment matters. Even though the symptoms may fade quickly, the risk of a major stroke immediately afterward is extremely high. That is why knowing what to do in the first minutes can save a life and prevent permanent disability. The most important action is to call emergency services right away. Do not wait to see if the symptoms pass. Do not assume that because the person feels better, they are safe. Emergency care allows doctors to evaluate the brain, identify the cause, and begin treatment before another stroke occurs. While waiting for help to arrive, it is essential to remain calm and keep the patient as comfortable as possible. Reassure them, because fear and panic can raise blood pressure and worsen the situation. Avoid crowding the person or moving them unnecessarily. If the person is awake and breathing normally, have them lie down on their back with the head slightly elevated at about 30 degrees. This position can help improve blood flow to the brain without straining the heart. If they are nauseated, vomiting, or unconscious, gently place them on their side to keep the airway clear and prevent choking. Do not give the person food, drink, or medication unless instructed by a doctor. Swallowing may be impaired during a mini stroke, and attempting to eat or drink can lead to choking. Some people reach for aspirin, thinking it will thin the blood, but this should only be done under medical direction. Because in certain cases, such as a bleeding episode, it can make the situation worse. It is also important to observe and record what is happening. Take note of the time the symptoms began, what signs appeared, and how long they lasted. This information is crucial for doctors because many treatments for stroke and mini stroke are time dependent. For example, clot dissolving medications must be given within a specific window to be effective. If you know the patient's medical history, share details about high blood pressure, diabetes, heart disease, or any medications they are taking. This helps the medical team act quickly and safely. If the person stops breathing or loses a pulse and you are trained in CPR, to begin chest compressions immediately until professional help arrives. While waiting for emergency care, loosen tight clothing to make breathing easier and keep the person warm. Watch closely for any change in condition, such as worsening weakness, slurred speech, or loss of consciousness, and report these to the medical team as soon as they arrive. Above all, never ignore a mini stroke or treat it as a minor issue. It is an urgent warning that a major stroke could follow within hours or days. Treating it with the same seriousness as a full stroke gives the best chance of preventing lasting brain damage. Quick, calm, and decisive action calling for help, positioning the patient safely, and providing accurate information can mean the difference between recovery and tragedy. 5. Treatment options for mini stroke. Once a mini stroke has occurred, immediate and thorough medical evaluation is essential. Even though the symptoms may fade within minutes or hours, the event signals that the brain's blood supply is unstable. Treatment focuses on preventing a full stroke by addressing the underlying causes and strengthening the circulatory system. The first step is accurate diagnosis. Doctors will often perform brain imaging such as CT scans or MRI to determine whether there has been bleeding or evidence of blocked vessels. They may use ultrasound to examine the carotid arteries in the neck, which are common sites of narrowing and plaque buildup. Blood tests can reveal high cholesterol, diabetes, or clotting disorders. By identifying the specific cause, treatment can be targeted effectively. Medications are often the cornerstone of therapy after a mini stroke. Antiplatelet drugs such as aspirin or clopidogrel may be prescribed to prevent platelets from sticking together and forming new clots. In patients with atrial fibrillation or other heart rhythm disorders, anticoagulants such as warfarin or newer agents like apixaban are used to reduce the chance of clot formation in the heart. Blood pressure medications are critical because controlling hypertension reduces the single greatest risk factor for both mini strokes and full strokes. Cholesterol-lowering drugs, particularly statins, help stabilize plaques in the arteries and decrease the likelihood that they will rupture and cause a blockage. In certain cases, more aggressive treatments are required. If a person presents to the hospital quickly enough, doctors may consider clot-dissolving medications, known as thrombolytics, to restore blood flow. These must be given within a narrow time window to be safe and effective. In some situations where an artery is significantly narrowed, procedures such as angioplasty with stenting or carotid endarterectomy may be recommended to physically open the vessel and restore circulation to the brain. These interventions can dramatically lower the risk of future strokes when performed at the right time and on carefully selected patients. Treatment does not end with medication or surgery. Long-term lifestyle changes are a critical part of recovery and prevention. Doctors will often recommend a heart-healthy diet rich in vegetables, fruits, lean proteins, and whole grains while limiting salt, sugar, and saturated fats. Regular exercise, such as walking or swimming, helps improve circulation and control weight. Stopping smoking and reducing alcohol intake are non-negotiable steps to protect blood vessels from further damage. Stress management, adequate sleep, and regular medical checkups also play key roles in maintaining vascular health. It is important to understand that a mini stroke is not simply a one-time event that can be ignored after the symptoms fade. It is a powerful predictor of future strokes. Studies show that without treatment, many patients will go on to experience a major stroke within weeks or months. By following the treatment plan carefully, taking prescribed medications consistently, and making the recommended lifestyle adjustments, older adults can greatly reduce their risk and protect their independence. Treatment is not only about addressing what has already happened, it is about building a defense system strong enough to prevent the next, far more dangerous attack. 6. Can you recover from a mini stroke? Many people breathe a sigh of relief when the symptoms of a mini stroke disappear, believing the danger has passed. Recovery may seem complete, but this is not the full story. A mini stroke, by definition, does not leave permanent damage to the brain because blood flow is restored quickly enough to prevent cell death. That is why speech returns, vision clears, or weakness fades after minutes or hours. However, true recovery is not simply about the disappearance of symptoms. It is about addressing the hidden risks that caused the event in the first place. From a physical perspective, most patients do return to normal function after a mini stroke. They may walk, talk, and live without obvious limitations. But this should never create a false sense of safety. A mini stroke is not a harmless episode. It is a forecast of what could happen next. Statistics show that many people who suffer a mini stroke will go on to experience a major stroke within the following days, weeks, or months if nothing changes. The body has shown that blood vessels are unstable, and without intervention, the same problem may strike again, this time with permanent consequences. Recovery, therefore, must be viewed as an active process. It requires medical care, lifestyle changes, and consistent follow-up. Doctors often prescribe medications to lower blood pressure, control cholesterol, thin the blood, or regulate heart rhythm. These treatments are not optional. They are essential to preventing another event. Regular checkups allow doctors to track progress and adjust treatment as needed. Imaging studies may be repeated to monitor the arteries and ensure that blockages are not worsening. Emotional recovery is also important. Many older adults feel anxiety or depression after a mini stroke, even if they seem physically well. The fear of another attack can weigh heavily. Support from family, counseling, and reassurance from healthcare providers can make a significant difference. Understanding that the condition can be managed and that action reduces risk helps restore confidence. Lifestyle adjustments are equally critical to recovery. A diet centered on vegetables, fruits, whole grains, lean proteins, and low sodium intake strengthens blood vessels. Daily physical activity keeps circulation healthy, reduces stress, and helps maintain a healthy weight. Quitting smoking and avoiding excessive alcohol protect the arteries from further damage. Stress reduction through meditation, breathing exercises, or community activities keeps blood pressure steady. Adequate sleep and social connection also contribute to long-term resilience. So, can you recover from a mini stroke? Yes. In the sense that most people return to normal functioning quickly. But recovery must be redefined. It is not just about the absence of symptoms. It is about preventing the next attack. Every mini stroke is a warning that your brain is at risk. Ignoring it invites disaster, while taking it seriously opens the door to years of healthy, independent living. True recovery is achieved not by waiting for the danger to pass, but by actively removing the causes and building stronger defenses. Treat a mini stroke as a turning point, not an end point, and you can protect both your brain and your future. 7. How to prevent mini strokes in older adults. The most important fact to remember about mini strokes is that they are preventable in many cases. Age and genetics play a role, but the majority of risk comes from conditions and habits that can be managed. Prevention is not about waiting for symptoms to appear. It is about building a lifestyle that keeps blood vessels strong and circulation steady long before a crisis strikes. The first pillar of prevention is controlling underlying medical conditions. High blood pressure is the single greatest driver of both mini strokes and major strokes. Regular monitoring and medication when necessary are essential. Blood sugar must also be controlled in older adults with diabetes, because elevated glucose damages vessels and accelerates atherosclerosis. Cholesterol management is equally important, since fatty deposits inside arteries can rupture and create clots. Regular checkups with a physician provide the opportunity to catch these problems early and treat them before they lead to disaster. The second pillar is nutrition. A healthy diet rich in vegetables, fruits, whole grains, legumes, fish, and lean protein provides the nutrients needed to protect the brain and heart. Limiting salt lowers blood pressure, while reducing saturated fat and processed foods helps prevent plaque buildup. Replacing fried and fast foods with steamed or grilled meals makes a powerful difference over time. Even small substitutions, such as using olive oil instead of butter or choosing water over sugary drinks, create long-term protection. The third pillar is physical activity. Exercise improves circulation, strengthens the heart, and reduces stress. Just 30 minutes of walking most days of the week significantly lowers the risk of vascular disease. Balance and strength training help older adults maintain mobility and prevent falls, while activities such as swimming, tai chi, or dancing improve endurance and mental well-being. Consistency is far more important than intensity. Gentle, regular movement is enough to protect the brain from future events. Avoiding toxins is another crucial step. Smoking is one of the most harmful habits for the arteries, doubling the risk of stroke. Quitting smoking at any age provides immediate benefits, with risk declining significantly within a few years. Excessive alcohol should also be avoided, as it raises blood pressure and disrupts heart rhythms. Older adults who eliminate these toxins give their blood vessels the chance to heal and recover strength. Prevention also involves lifestyle balance, stress management through meditation, deep breathing, or mindfulness reduces the hormonal surges that constrict blood vessels. Adequate sleep allows the brain to restore itself each night. Staying socially connected prevents isolation and depression, both of which are linked to higher risk of vascular disease. Ultimately, preventing mini strokes is about daily commitment. No single choice guarantees safety. But together, these habits create a powerful shield by controlling medical conditions, eating wisely, staying active, avoiding harmful substances, and maintaining emotional balance. Older adults can greatly reduce their risk. A mini stroke is a warning, but prevention ensures that the warning does not turn into tragedy. Protecting the brain is not about perfection. It is about persistence. And every small step you take today secures your independence for tomorrow. Doctor's final words. As a brain doctor, my final message to you about mini strokes is one of both warning and hope. A mini stroke is not a small problem. It is a loud alarm from your body telling you that a major stroke may be near. The symptoms may fade, but the risk does not. Treating these events as harmless or waiting for them to pass is one of the most dangerous mistakes an older adult can make. Every mini stroke represents an opportunity to act before permanent damage occurs. By recognizing the signs, seeking immediate medical attention, and following through with treatment and lifestyle changes, you can prevent tragedy. Recovery is possible, but prevention is even more powerful. Managing blood pressure, controlling diabetes, lowering cholesterol, eating a balanced diet, exercising regularly, quitting smoking, and limiting alcohol are not optional suggestions. They are the foundation of protecting your brain. Mini strokes remind us that the brain is fragile, but also that it can be safeguarded when we make the right choices. Each healthy meal, each walk, each doctor's visit, and each stress-reducing activity builds a barrier against the next attack. Do not ignore dizziness, a sudden weakness, slurred speech, or blurred vision, even if they disappear quickly. Do not assume that because you feel better, the danger has passed. Call for help. Get checked. And take action. Share your own experiences in the comments, because your story could inspire others to recognize their warning signs and seek care before it is too late. Remember this truth. A mini stroke is not the end. It is the beginning of a choice. Either ignore the warning and risk losing your independence in a major stroke, or respond with urgency and give yourself the chance for many more years of clear thinking, movement, and dignity. The decision is yours, and the time to act is now. Protect your brain, because once it is lost, it cannot be replaced.